All right. So, hello everyone, and welcome back to quite possibly the only orthopedic podcast where we cover all things orthopedics. It's Everyday Orthopedics. I'm your OT host, Karen Cappleberry, and joining me today is my fellow OT.
Good morning, I'm Rhonda Birchman. And thanks for tuning in. This week we are going to go over a topic that gets we get questions over quite a bit, which is fractures. Yay for fractures, but not really, because no one wants a fracture.
I sure don't. But unfortunately, fractures are kind of one of those things that just happen because human bones aren't made of steel. Bones can break. There are over 6 million fracture incidents in the U.S. every year.
Wow, that's a lot of broken bones. So we understand that people might have questions regarding the different types of fractures, treatment processes, or other fracture-related concerns.
That's right. You know, some fractures happen where the bone doesn't even completely break, like stress fractures. Stress fractures are tiny cracks that occur in bone due to, can you guess? Stress! These types of fractures can occur from repetitive force or use, so take it easy.
That goes for kiddos too, right, Karen? Because children are more prone to sustaining green stick fractures. Ouch! These kinds of fractures usually happen due to a fall on the arm, and because the bone is still somewhat soft, it doesn't completely break. It bends and cracks, somewhat similar to breaking off a small branch from a tree, except it doesn't ever break. Hence the name.
Wow, just stick it to me where it hurts, Rhonda. So, moving on to our case study, we're going to take you to behind the scenes, if you will, and allow our viewers a chance to experience the process someone goes through after sustaining a fracture.
Yes, and take in mind that no two fractures are ever the same, because there are several fractures that can affect the recovery process. Some include the patient's pre-morbid health status, age, location of the fracture, and severity of the fracture.
Speaking of severity, do we know if the patient in our next case has an open or closed fracture?
I believe Maria sustained a closed fracture. For those of you who don't know, Karen will explain it to you.
All right. So, sounds good, Birdschmear. So if I had to choose between an open or closed fracture, I'd choose a closed one for sure. A closed fracture is a nice and neat compared to an open fracture. Because an open fracture, which is sometimes called a compound fracture, actually pierces through the skin. And you can have bones and bits everywhere, which means surgery and fitting these bones together again. A closed fracture just means the bone doesn't break through the skin, so there's less mess and easier recovery.
Okay, well, in a few seconds, Karen and I are going to
Share our screen
for all the viewers at home to watch along. But before we do, we wanted to give a quick shout out to our OT colleague, Mr. Savage. We are so grateful for you sharing this. We are so grateful for you sharing this video with us in order to educate our viewers on fractures and share what they can expect during treatment.
All right, let's get into it. We will be taking a look at Maria throughout her OT treatment as she visits with Mr. Savage. I believe we will be seeing her in 3 separate sessions, which are recorded over a period of weeks. Just for some background, Maria was in her mid-30s when she was injured during a soccer game, which left her with a proximal shoulder stress fracture to her right arm. This was Maria's first fracture injury, so she understandably may be apprehensive on what to expect during her OT treatment. Okay, Rhonda, we're ready to go. Let's take a look.
Cute.
All right.
Hello, everyone. Hello, Mrs. Messi. I'm Mr. Savage. Here's some information that we're going to go into when we discuss today. How's your arm today?
It's doing better now that we put the sling on it yesterday.
Okay, perfect. That's what we're actually going to get into some different methods that we're going to do to get you into rehab. We want to get you started as soon as possible exercising because that'll help increase the chances of you returning to your prior level of function. What do you say we get started?
But what are we going to be doing today? Because my arm does hurt sometimes.
Well, that's a good question. We are going to be doing any movements that can cause you pain in the arm, but we still have to work on the other areas of your arm, including your hand, wrist, and elbow, as we want to prevent any stiffness and weakness of that arm. before we get into that, we're gonna have to do some preparatory methods to simulate that arm.
And what are those?
We're actually gonna be using our hot pad right over here. So the hot pad method we're gonna need to use in order to prepare your arm for the activities that we're gonna be doing. So with this, you can either put it in the microwave for a few minutes. I'm gonna teach you how to do that so you can help your husband, or you could even go the alternate route, which is to boil it in hot water and leave it in there for 5 to 7 minutes.
Okay, yeah, I've seen those at work before, but I've seen also someone burn an elderly patient, and I'm kind of scared now. We won't hear the end of it.
Oh, well, don't worry, you're in good hands, like Allstate, you know? Plus I know a thing or two, because I've seen a thing or two. Okay.
So what's after the hot pad?
We're gonna actually be using, oh, I didn't grab them. Can you grab me the balls? I didn't grab them. We're gonna be using some different balls that you're gonna be squeezing. Each is a different tier level from easy to hard. We're gonna have to work for this for about a week or two, since we don't want any pain in that arm. So my assistant here, thank you. Okay, so we're gonna start at a lower level, so this is easier for her to squeeze. She's just gonna be moving, and we wanna prevent any stiffness in these arms. So we're just trying to keep some movement. We don't want any muscle atrophy to set in, so we wanna make sure everything else is working around the area that is affected. So we'll increase the difficulty now. And she'll be doing this a few times a day, 4 times a day, so she wants to be doing something while she's doing these. She said it's a little easier, so we'll give her something harder now. So max tier level.
Okay, that's too hard.
It's too hard. So we don't want our client getting upset with us, so we will move on. So like I said, she'll be doing that a few times a day for 10 to 15 minutes, so you want to make sure your client has, you know, something that they're interested in, like a show, or maybe she can just watch her daughter play with her toys, since they want to see, look mommy, they want to see you do everything. So, is that a relatively easy exercise for you to do?
That seems easy. I just want to get better so I can get back to taking care of my daughter.
Well, perfect. We're gonna make sure we keep that same energy, so that way we can have you cooking and playing soccer and also seeing your daughter. I also want you to utilize some adaptive equipment. So here we have our sponge stick. So because that arm is immobilized, we want to make sure that you do keep a little bit of independency. And with your arm that's not affected, you'll be giving yourself some help when you're scraping or scrubbing your back. You know, we
My
scrub
back.
our backs in this
We don't-
class. I'll let y'all know.
Does it click?
Good.
Yeah,
Mhm.
I don't scrub my legs. Miss Gibson said we don't have to.
So just be aware. And we also have this. So this is our, what is this called? Our cutting board. Assistive cutting board, of course. So just so you can get by cutting some of your favorite vegetables, just so you can fill the need of the cooking that you love to do. Okay.
All right, I'm gonna try my best in doing these and doing what I can so I can get back to my daughter.
Perfect.
Bet.
It. Closing.
Well now, that didn't seem too bad, did it?
Not at all. We saw that Mr. Savage was practicing a holistic approach by attending to all parts of his patient, not just her physical injury, but taking time to touch on her mental well-being.
Yes, and I'm sure there will be more of that to come, because as an OT, we must sometimes use a variety of methods when it comes to treatment.
You make a good point, Huckleberry, and speaking of methods, Mr. Savage is applying both a biomechanical and rehabilitation approach in regards to Maria's treatment.
True, and a biomechanical method really targets remediating the loss of range of motion and strength that is often associated with fracture injuries.
Exactly. And the rehabilitation approach is ideal in situations where you have to compensate for those deficit areas, whether it's short-term or long-term.
Well, I'm curious to see her progress. Let's get back to it, y'all.
Hi, Mrs. Messi. Great to see you again.
Hi. So what are we gonna be doing today?
Actually going to introduce you to some new exercise today. We're going to be starting the pendulum exercises and active assisted mobility.
Okay. So what are we doing?
For the pendulum, you'll be doing this before your active assisted, and we're gonna be working on some shoulder mobility exercises since you really don't wanna put any strength, you don't wanna put any resistance on that shoulder. We're gonna do that to keep those muscles working, and we also wanna relieve any stress. So we just wanna build on some shoulder mobility. So you'll take your hands, you'll place them here on our table. You're gonna have your legs shoulder width apart, and you're gonna lean forward a little bit, and you're gonna drop the affected arm down. So only gravity is pulling on this arm. And now what she's gonna do, she's gonna shift her weight and move side to side. All she wants to do is have some mobility of that shoulder, but we don't wanna add any stress on that shoulder area that's affected. So that's what we'll be doing a little bit of. And then now you're gonna sit down and we're gonna do some active assisted mobility. So when you sit down, your unaffected arm is gonna be placed under your affected arm.
Okay.
So here.
Here?
All right, and you're gonna keep,
Here?
yes, right under your elbow, right there. You're gonna keep the affected arm flexed here.
Okay.
And now what she's gonna do with her unaffected arm, she's gonna help push the affected arm up. Now if she experiences pain,
Okay.
you want her to stop.
I
Do you have
feel
any
it.
pain?
Yep.
Okay, perfect. So that's where we're getting some range of motion to that shoulder. So and then back down. And if she wants to make it more difficult, she can flex her elbow a little bit more and increase
Okay,
just
yeah.
like so.
That's,
And then
yeah.
move up.
Okay,
Perfect. Down. So these two exercises you'll be doing at home, and also here when you see me. And now make sure, I didn't tell you last time, but when you're doing your exercises, you wanna make sure that your sling is off. That's the only time that your sling will be off while you're still immobilized. So only during your exercises is when you'll have that sling off.
Okay.
All right, well, let's get started on them shoulder swings. We'll continue seeing each other for a few more weeks.
Okay.
You did it like I was proposing?
Wow, we talk about biomechanical, eh? Well, we really saw Mr. Savage focusing in on the biomechanical aspect of her treatment plan.
That's right, they are getting into the sweet and spicy because remember, in order to recover and allow the fracture to heal properly, you need to include activity to get those joints moving.
Which can be difficult for the patient sometimes. The fear of re-injuring themselves by moving the wrong way is actually a common worry for fractured patients, which can also lead to prolonged immobilization of the injury site, and that's the last thing that you want.
Very true. That's why OTs know how to emphasize the importance of exercise and movement in the recovery process. Because when we exercise, our blood vessels expand and allow nutrients and oxygen to be delivered to our bones. And along with that, our bodies release a molecule called ATP, and that stimulates new bone growth.
That is so true, Rhonda. I hope she will make a speedy recovery. Let's take a look at her last phase.
So Maria has progressed to the point to where she's no longer wearing her sling. So, hey Maria, welcome back. How are you feeling? I see you don't have your sling on.
Much stronger. I feel way better.
Perfect. Do you think we can start adding some strength exercises to build some muscle in that shoulder?
Definitely. I'm
Okay,
ready.
perfect. Imagination. This is a dumbbell. So we're gonna start using some flexion raises. So you wanna keep your affected arm straight throughout the whole process. So we're only focusing on this. So she's gonna raise up and then down. And you can increase the weight depending on the level that your client can actually work with. So that's perfect. I'll have you do those during today's session. And now we're actually gonna do some resistant training as well. So we have our band here, and we're actually gonna come over here near our door. And we're gonna hook this along a staple door. Now we're gonna have Maria hold this end here. She's gonna have her elbow and shoulder adducted into her body. She's gonna be facing the door, and she's gonna grab on with her hand here. And she's just gonna be going across her body. Anyone know what this is called? What are we doing with the shoulder here?
External rotation.
Okay, good. And now she's gonna flip position, and she's gonna have her going into her body, and this is internal. Okay, now she'll be facing the door, and she's gonna be pulling it with the shoulder blade going into her spine, just like so. Perfect. What's that called? Retraction. Perfect. Good. And we'll quit here. Perfect. So we'll be doing those in today's session, Maria. And also, let me go this way. I want to talk about you continuing these, and I want to make sure that you understand that not everything's going to be fine wine while you're doing this process. So you're going to have some difficulties. You may get a little depressed because your strength's not going to be what it once was. So I want to make sure you take the necessary precautions to reach out to anyone if you need help. And also, when you're going home, I want you to continue using any adaptive equipment that you may need in order to help you. Are you really crying? Okay, no. All right. You have to use a sponge. If you still feel you don't have that range of motion in that arm, I want you to continue using the sponge. We also have a reacher here that you can use. I know you said you like to cook, so you need to get them spices. You may have to reach a little farther. So that will help you. Oh. There you go. I was like, what? There you go. And that'll help with your range of motion in that shoulder, as well as the cutting board. When you use it, just try to position it farther away from your core. That way you can increase that range of motion. Bet?
Bet.
That's what I call progress. She now has the tools to become completely independent, as well as tips to maintain a healthy lifestyle to further help in preventing re-injury. Well, why don't we wrap this up by taking a question from one of our live viewers.
Okay, let's do it. Why don't we take this one? This is from user Look Mom No Pants. They ask, how does an OT know their patient is making progress with their movements?
Wow, great question, No Pants. Well, one way to keep an OT, the OT keeps track of their patient progress is by goniometry, which is a tool we use to measure a joint's range of motion. It's something an OT can record each time a patient comes in for treatment, which allows the OT to keep track of their progress.
This was fun, Cackleberry.
So much fun. I hope our viewers were able to learn a bit more on fractures and the benefits of occupational therapy that it can provide during the recovery phase. See y'all next time on Everyday Orthopedics.